Appreciate you being here. A lot of activity going on these days in the Capitol. We are here specifically to speak with you about Benefind. This is part of Connect. Want to clarify a number of things. There has been a tremendous amount of misinformation that has been put out there. Our primary focus, our primary concern, that of not only myself and this administration, but the folks from Deloitte and all those who have the interface with our clients, the primary focus is to ensure that we deliver as seamlessly as possible, as safely as possible, as expediently as possible, all the benefits that folks expect and need from the Commonwealth of Kentucky. It should be a joint effort on the part of all parties concerned to ensure that that happens. This should be the desire of everyone, including those of you who report this. It is good for Kentucky if, in fact, we take care of the citizens of the Commonwealth. There has been a tremendous amount of misinformation. Some of it has been intentionally spread. Some of it has been unintentionally spread. There have been certain individuals who have very intentionally misled you, have absolutely not given you the truth as it relates to what Benefind is, when it was created, what changes, if any, have occurred to that system. There has been a tremendous amount of misinformation about connectors, what their role is, what their interface, what their access is, what their availability is. We will address some of those as well. The thing that I want to make abundantly clear, we will take care of our employees. We will protect our employees, we will facilitate their ability to do their job, and we will do so by allowing them to take care of their clients, the people of the Commonwealth. This is our commitment. This is our focus. This is what everyone on this stage and in our respective organizations is committed to. This is what we were elected to do. This is our responsibility. This is what Deloitte has been hired to facilitate with making happen. I want our workers that are out there to understand, we understand this has been frustrating. A number of folks are actually here with us today, and I appreciate that. This is not an easy task. When there is a transition of any kind, it is not always easy. But we will work with you. We ask for your patience in this process. I want to correct a couple of things, and then we will turn this over. You will hear from others that are involved, and then we will open it up for questions when we are done. It is a tremendous disservice. It is irresponsible, and frankly, it's an embarrassment to the state of Kentucky when previous administration officials will intentionally mislead those of you in the media. It's an embarrassment to Kentucky and to your professions when you take lock, stock, and barrel those deceptions without corroborating them, without speaking to somebody who could corroborate them, without even speaking with this administration or with people at Deloitte. It's irresponsible. It's sloppy journalism. Your readers, your viewers, they deserve better than this. The net result of this is that it creates a level of unrest and uncertainty, of concern. Nothing good can come of that. We owe it to people to put our best foot forward in terms of the truth. You will hear the truth of when Benefind was put in place. Benefind is Connect. They are not two different things. Benefind was developed going back now to 2014 as part of a system that had been put in place 2 years prior to that. Despite what you've been told, it was absolutely intended to be a vehicle through which people signed up for every single benefit that they might need, so that there would be no wrong door for entry. That would include Medicaid, despite the fact that previous administration officials who have no involvement whatsoever now, but are being quoted by many of you as if they do, they are misleading you as to what the purpose was. This is unfortunate. We will correct that today. There's also misinformation with respect to the fact that this is something new and that things have changed, that changes have been made to this process by the current administration. Also 100% incorrect. There have been no changes. It is rather an implementation of the very things that were put in place by those that preceded us. It is a rolling out of something that has been in process for quite some time. These are things that need to be understood by folks. There's been misinformation about connectors. Some have reported that the connectors are no longer around, that they're not connecting. That is not true. All 500 connectors are still under contract. All of them are still working. All of them have access to Benefind. They may have some frustrations with it, some confusion about it, but the fact is, it is their responsibility and they are being paid to facilitate people in the use of it. These are also things that need to be clarified and properly addressed. There's been conversation as well about a number of other things, and we'll get to those, some driven by your questions and some by comments that will come. But it's important to understand this is a system that is designed to facilitate the on-roading of everybody who needs benefits from the state. The previous system was out of compliance, which is why this one was developed. Benefind is Connect. Connect is Benefind. They are one and the same. They were designed by the previous administration in the years that preceded our involvement with this, but it is our responsibility to ensure that it is implemented properly, that the people receive the benefits that they need, and we are committed, both our organizations, the state and Deloitte, to ensuring that that's exactly what happens, and that for those who are getting errant notices or are concerned in any way by some misinformation that has been reported to them, their benefits will continue. There are workarounds being done to ensure that any technical glitches are being remedied by manual effort. I want to turn things over to take you through a timeline of what has and hasn't been the case in the development of this, and with respect to their involvement in this process, because they have been from the very beginning, to Debbie Sill from Deloitte.
Thank you, Governor Bevan, for the opportunity to be with you today and underscore Deloitte's commitment to the Commonwealth of Kentucky and the people you serve. We fully realise that our public sector work impacts the lives of people, often at a time when they are most vulnerable. We know that the rollout of Benefind has caused frustration and concern for families and for field staff. I assure you and the people of Kentucky that we are working in close collaboration with your team to identify, prioritise and resolve these issues as quickly as possible. Some of these challenges relate to issues in the system. Although the federal government approved the system's design several years ago and Benefind was thoroughly tested and piloted before launch, there were some issues that didn't present themselves until after the system went live. This is often the case with large-scale technology projects, and we are working diligently to fix these issues. None of these issues are caused by any changes the current administration has made to the system's purpose or design. For example, Benefind was designed to automate eligibility determination and generate notices for certain cases on a daily basis. That design, which dates back several years, including automating data matching with certain state and federal sources. Unfortunately, some of those data sources contain inaccurate or outdated information. This has caused thousands of letters to be generated and mailed to people with incorrect information. We are making daily enhancements to the system to modify these processes, correct data errors, and relieve the confusion that they have caused. There are other issues impacting consumers and field staff that are the result of policy decisions and federal regulations that date back several years. Following passage of the Affordable Care Act, the former administration made the decision to create a single integrated system for health and human services. As a result, Benefind was specifically designed to automate and integrate the eligibility processes across multiple health and human services programs, so field staff can address all families' needs and determine if they're eligible for more than just medical care. Having one integrated system also strengthens data integrity across all programs. The goal then, as it is now, was to coordinate benefits so there's no wrong door for someone seeking health insurance, Medicaid, SNAP, or TANF benefits. Benefind has not replaced Connect. Consumers will still use Connect to purchase private health insurance. As the Commonwealth transitions to healthcare.gov, Kentuckians will be able to access the exchange directly. They will not have to navigate Benefind in order to purchase health insurance. Benefind will, however, continue to process eligibility for all programs, including Medicaid. To be clear, none of the issues with Benefind are related to the move to the federal exchange, and there have been no changes to the Connect or Benefind systems as a result of that decision. There have also been no system modifications to disable or delay functionality for insurance agents and connectors. Finally, we know field staff are frustrated by the amount of data that must now be collected for the first time a case is processed in Benefind. This data collection is required by federal government, and the method is designed to ensure the integrity of the data. We know that this has impacted the day-to-day activities of the field staff and affected their efficiency. We are conducting a full review of the data entry processes and making improvements where we can. In closing, I want to reiterate Deloitte's commitment to the people of Kentucky and assure you that we will continue to work side by side with your administration to get people the vital benefits to which they are entitled. Thank you for providing me with the opportunity to be with you today.
Good morning. I'm Secretary Gliston, Secretary of the Cabinet for Health and Family Services. The Cabinet for Health and Family Services is tasked with providing benefits and services to Kentuckians. Please know that we are doing everything in our power to prevent the delay of benefits to those who are eligible for benefits. We take our mission and our obligation to our clients very seriously. We have pulled resources from all departments of the Cabinet to focus on issues related to this system, and more importantly, to develop practical solutions to allow Benefind to operate. We have worked tirelessly with Deloitte to help identify issues that are causing disruption to system operations. We are implementing aggressive strategies on our part to ensure benefits are not delayed. We have engaged the federal government and have been successful in obtaining an extension for Medicaid and SNAP benefits. What this means is that for anyone who received Medicaid benefits in March and were at risk of losing those benefits in April, they are now being extended and their coverage should continue. We were also able to move the recertification time frame for SNAP benefits from 6 months to 12 months, which simply means that the cases will continue based on an expedited review. You know, there's an old adage that the worst situations bring out the best in people. And I think that's true in this situation. And at this point, I really want to acknowledge the members of our team at the Cabinet. These are individuals who have come together to work collaboratively and have come across all departments. And I want to thank each of them, especially our really hardworking, dedicated field staff who have been really through a lot. I'm really, really proud of our team. As Secretary, my motivation is to provide the very, very best environment possible for our workers and to provide the highest level of service to the clients that we serve. The people we serve are not simply numbers on a spreadsheet. These are clients that are individuals and families. They're young and old. They're of all races, and they're from all walks of life, and they need our help. We appreciate your understanding and your patience as we continue to work with Deloitte to try to make sure that no one in the state loses their benefits. Thank you. And at this time, I would like to introduce Commissioner Adria Johnson, the Commissioner of DCBS.
Good morning. My role as Commissioner for the Department for Community-Based Services puts me and my dedicated field staff on the front lines of this issue. Local offices across the state are struggling as our lobbies have been full and our call centers have been inundated with phone calls. In some cases, dealing with erroneous letters generated by the system has accounted for more than 50% of the workload for some staff members. We deeply regret the confusion this has caused, and in an effort to reduce this confusion, we have stopped those automatic notifications and we have put in place a validation workforce team to ensure that all notices that are issued from the system are accurate. With respect to the workforce and efforts to increase proficiency in navigating the system, we have a plan to put a Deloitte trainer in each of our offices in all 120 counties. We have found that having additional resource in place really speeds up processing time and gives staff a great source of support as they learn the details of the new system. Right now, we have nearly 50 Deloitte trainers in the field. We have also added nearly 200 additional staff members to help process these cases. We are also sending daily emails to our staff with tips on how to better utilize the system. We are sharing information, both challenges and opportunities, among our county and regional offices. We are also giving them more resources to better communicate with their staff. Finally, I would like to thank the Governor and the Secretary for acknowledging the hard work staff members do and for asking that the public be patient. Serving the clients of the Commonwealth is our utmost priority, and they are working tirelessly to work through the high volume of cases. I'll now turn it over to Commissioner Miller.
Good morning. Medicaid just recently became aware that several system-generated letters have been mailed out to recipients stating that the recipients no longer had Medicaid benefits. The overwhelming majority of these letters were wrong. This has led to a lot of confusion among many Medicaid recipients. This confusion and anxiety has flooded our phone lines as well as the DCBS lobbies. The letter indicated that benefits would end April 1st. Let me assure you, that will not happen. We have put strategies in place to keep those benefits active so that no one loses Medicaid coverage in the month of April. We are reaching out to the people who received these letters to let it know that it was a mistake. We have reached out to our partners, the providers that provide the services to our recipients, the MCOs who provide the coverage, to make them aware of the situation. They have been extremely helpful. We want to make sure that those providers approve upcoming services, appointments, and procedures to these Medicaid recipients just as they would normally do. It should be business as usual in the month of April. The actions I've described were taken to prevent the loss of our delay of benefits. We appreciate everyone's patience as we continue to work through this issue. Thank you.
Let me just say to kind of wrap up, and then we'll open it up to questions for myself or any of those that have spoken. I just want to reiterate what has been said and express my gratitude as well for the tremendous work that has gone on. Secretary Glisson and her entire team in the cabinet have done an extraordinary job of handling what has been a remarkably unexpected result. The net result of this, though, is that they have worked together with Deloitte. They have worked together with everyone up and down the line. They have worked together with the federal government to ensure that the impact will not be felt by the citizens of Kentucky as it relates to their benefits. This is what professionalism looks like. This is what we should strive for. The continued dissemination of anything to the contrary, the desire for there to be dissension in the ranks, the misreporting of facts, not only by those previously in the administration, but by currently elected officials, stating that somehow this was a desired effect. Not true. We've laid the facts out there. It is the responsibility of those in the media to report the facts, to report the truth from those who actually are at the helm. In so doing, it will help to alleviate a lot of the concern, much of it misplaced on the part of people as a result of misinformation. And those parts that are well placed because of the mistakes and glitches that have been referred to also need to be clearly defined. So we appreciate your attention to this. This is a big issue. 1.4 million Kentuckians receive some form of benefit. It's roughly a third of our entire population. This touches every single one of us in this room. Every one of you knows somebody who is a recipient of this. You have a responsibility to be accurate, to be truthful in the things that you report, to get both sides and make sure you have the true story. It's important because, as was noted, these individuals are somebody's mother, somebody's father, somebody's sister, somebody's brother, somebody's son. Not only those who work here, but those who are the recipients. We owe them the ability to do this to the best of our ability. Any questions that you have for any of us? And let me start over here. I'll start here if you have a question. Go ahead, Lawrence.
Just to be clear, you're saying that Benefind and Connect were always intended to be together?
That is correct. But let me, in fairness, let Debbie speak to that because she and her team are the ones who have been designing this from the beginning.
Thanks, Governor. Yes, you're correct. This is an integrated system, so each of the benefits can be accessed through Connect and or Benefind. It's like having two windows into the same set of benefits. So I think perhaps what's behind your question is when you turn off Connect, will you lose access to some of those things that are underneath? And the answer is absolutely not. So what happens today, particularly for the Medicaid population, is that you can enter the system through Connect. If you need Medicaid eligibility processed, it will move you over into the Benefind application and it will take place there, and then you'll get your result back through your portal. When the Connect portal is turned off, then you will simply access that, directly through Benefind.
So the Connect portion of it was then rolled out first
Correct.
before the rest of it. That's the issue here.
I don't know that it's an issue. I think it's an iteration. It is an ongoing iteration. As software is developed, I think it's important to understand it has continued to be enhanced. The old system, it's important to understand, was out of compliance. The old system it is not possible to go back to something because it is not in compliance with what is required by the federal government. And so this system is, if you think about it, everybody upgrades their software. You have 2.0, 3.0, 4.0. I don't know which .0 Benefind is, but it's some further iteration of Connect. And correct me if I'm wrong, but I believe it was started 2014 is when the actual development of Benefind began, with the intention of it being rolled out even earlier than we chose to roll it out to ensure that it was as ready as it could be.
That's correct, Governor.
Any other questions?
One more from me, if you don't mind.
Sorry, we have a 2-question limit for.
So this does not affect at all your plan to phase out Connect?
No, again, I think as was very clearly just stated by Debbie, these are, at this point, somewhat redundant. Connect still exists. It always was intended to exist. The reporting to the fact that it has been shut down is incorrect, not true. It does exist. The connectors are still there. They're still under contract. They are still expected to be connecting people, however you spell that. The bottom line is that is their job. And so when Benefind is in place and working as it should be, and that's what Deloitte is committed to ensuring happens, then it will be the vehicle through which people get all the very benefits that they have always historically gotten.
How long is it going to take to fix all the problems? And then also, is this costing the state any extra money to fix the glitches?
This is a contract that we had with Deloitte. Part of their contract is the successful delivery of this system. And so the answer to the second part is no. The additional people that they are bringing is part of the fulfillment of the contract that we have with them. With respect to how much time, I wish I had a crystal ball that could give you the exact date. We anticipate that with everything we fix, there will still be little things that bubble up here and there. It has ever been thus. Any of you who have ever upgraded the software in your cell phone, for example, understand that this is how these things work. Now imagine that times 1.4 million. There will be things that will continue to bubble up, but they will be addressed. And we are confident that these will be addressed in a timely manner in the days, weeks, and months ahead of us.
Are you suggesting that the Bashir administration misrepresents?
No, we'll come back. We'll come back to you, Debbie. I'm sorry. Well, since he's jumping in there, go ahead, and then we'll come back to you. Or Debbie, go ahead.
You've described this as glitches and technical mistakes, but it's statewide. It sounds like it's a lot more than that. It sounds
No,
like
exactly.
you're describing it as disastrous and a crisis. I mean, how would you characterize
Those are words that you all have used, and those of the previous administration. Yeah, that's our former governor. Our former governor used the word disaster on his Facebook page.
people in the field who have lost benefits?
Yes. Again, it's a function of interpretation. For someone who has had a letter sent to them erroneously, that you can understand how they might interpret that any number of ways. And they have every reason to feel that way. The word glitched is not meant in any way, shape, or form to minimize this. As we have just noted, thousands and thousands of inaccurate letters have been generated by this system. That is not how the system was designed to work. And yet you have also heard how, in conjunction with those behind me on this stage and those in the federal government, we have come up with solutions to ensure that those very same people who can use whatever adjective they like will not lose their benefits. While it is their prerogative to use the adjective of their choice, the most important part for us is to make sure that they actually get their benefits. And that's what we're doing.
My apologies. Are you suggesting or that the Beshear administration deliberately or inadvertently misrepresented the readiness of Benefind to come online or the compatibility of the databases?
I could read you exact quotes, if you'd like, from them. I've got a number of them here. I won't do that other than to say there has been a very intentional misrepresentation of the truth.
On the front end or the back end?
I think at various stages along the way, including very recently as this has been rolled out. Any other questions?
Bottom line.
Ron, let me get Roland here.
Okay, I'm sorry, Ron.
Why was Benefind rolled out if you knew there was going to be problems with it?
Believe you me, if we had thought that there were going to be this degree of problems, they would not have been. I'm going to defer to Debbie to talk about the beta testing that was done. It was a tremendous amount done before we were in office. This was done under the previous administration. It was their belief that it was ready to be rolled out, even in advance of when we did. It was their anticipation that it was prime time and ready to go. We had some hesitations and we delayed that. We had some assurances that it was ready. But Debbie can speak more aptly than myself to exactly what was done to ensure that it was ready to be rolled out.
Thank you, Governor. As with any large-scale system implementation, we followed a normal testing and rollout schedule. So we worked with the Commonwealth of Kentucky to do user acceptance testing, where we bring users in from the field to run through their case volume and so forth on the system to make sure that they're comfortable that it works effectively. Then we took it to pilot in 10 offices, which means we actually use the system in a live environment in 10 offices for a period of time so that we could assess the readiness of the system to go into production. Finally, we had it reviewed and agreed upon by the federal government for readiness, and at that point we made the decision that it was ready to go into production. Now, as I said in my remarks, some of these system errors that we're seeing today did not present themselves through that process. Again, this is something that often happens with very complex, very large-scale technology systems. And unfortunately, in this case, that predominantly was focused on these notices that have caused a lot of confusion and issues for the citizens of Kentucky. So we are very focused on solving those issues and getting them resolved just as quickly as possible.
How much is the Deloitte contract for dollar-wise, and how long does it run?
I'm not sure that I can answer either of those questions precisely, but we could get back to you with the details. You know, what you do know is that it was a sizable contract. It was a contract that was let a number of years ago, in 2012, to design, develop, and implement this large-scale system integration project that we know today as Connect and Benefind. That proposal, cost estimate, and scope was reviewed both by the Commonwealth of Kentucky and by the federal government to validate that the scope of the proposal and the price of the proposal was appropriate and accurate for the work that we undertook.
Does it have a set end date, or is it until it works?
All contracts have a set end date. Our commitment is to make it work. And so we're not really focused on the end date, but I'm assuming there is an end date. I can't tell you exactly what that is today, but that's a fact that we could get back to you with.
I've got another question. It looks like there's a 27-page worker portal defect workaround guide. It was sent out in February. It's 27 pages long with problems with the system. And it's sent out to DCBS workers and whatnot, and that's before Benefind rolled out. So it seems like you had a pretty good idea that there were going to be problems with it. So why was it ultimately rolled out?
This is normal process for a large systems implementation project. All large systems that go into production have some issues. None of the issues that we include with workarounds for caseworkers are issues that would affect benefits, either the eligibility determination of those benefits or the payment of those benefits at all. These are issues primarily of how the system is being operated by the staff, and the reason that we put the workaround document out to staff is so that they can be more efficient in navigating through that system. So this is a normal process that we do with all systems.
Can I ask about the continuation of benefits? You all indicated that the letters have gone out, that they're erroneous and people actually will be covered. Yet I've talked to a number of folks who are not covered. They say their cards aren't being honored or the payments aren't being processed, and that includes folks in the Michelle Poole and Medicaid waiver. Do you know why that would be if?
Adria, do you want to take that, given that so much of this falls under DCBS, of the things you've specifically asked about, and Vicki, weigh in as you think?
As you heard mentioned earlier, we have worked with the federal government, both with CMS and with FNS, Food Nutrition Services, to ensure that no one is losing benefits. And so we have, again, the extension of recertification periods was key, that anyone that was coming due with benefits that would have discontinued, that extension period has been extended. We have worked to identify anyone that we have been made aware that has lost benefits. We have worked to quickly rectify that situation and ensure those benefits have been issued. So we have taken the appropriate measures to be proactive and to be responsive when we've been made aware of instances that have come up.
Do you have any idea how many people may have lost benefits?
I do not.
And I think Commissioner Miller might be able to talk about the Michelle P. and
And I might like to add to that is the fact that we've reached out to the providers to make them aware of the fact that the Medicaid coverage is still in place. And that goes over the waivers as well as does traditional and expanded Medicaid. And clearly, there's going to be some confusion on that. We know that. We are reaching out to more providers today as well and trying to supplement that information. We've also extended that information out to the MCOs to let them know that anyone who was covered in the month of March, that they will also have coverage in the month of April as well.
Can I also follow up? And I would just like to note, I think it's important, and again, in no way to be dismissive or minimizing of the current situation. But we have, even before the launch of Benefind, under the old CAME system, which was very antiquated and, again, out of federal compliance, it is not uncommon for benefits to discontinue at the end of every month. We know that happens. So in some ways, this is not unique to just the launch of this new system.
It's a good point. These are rolling, all these benefits are rolling in nature. There's not a one, it's not like enrollment on a federal exchange or a state exchange. Doesn't happen just in a certain time frame window. It is a rolling. Any other questions?
With the complications of this rollout, what can you say to assure nervous Kentuckians about the possible smoothness or not of the switch to the federal exchange, which could include a lot more moving parts?
Again, I think the wonderful thing is that we have years now worth of realization of how the federal exchange works. And it was noted by many in its first year/years of existence. Smooth was not the word you probably would have come up with to describe it, which was one of the reasons it made state-based exchanges look pretty good by comparison. It has now been worked out. It's what's used by essentially all but a handful of states, and it is something that has been used now for years by dozens and dozens of states. We're confident that our experience with it will be the same as it has been for those dozens of states in the last 2, 3, 4 years.
So when people call who have issues or concerns, will they now be able to talk to someone in a timely manner?
Again, I'm going to, Vicki, do you want to speak to, or Adria, what we've done to put in place the ability to receive that, those calls? Or
also Deloitte. We have worked really hard to make sure that we can make someone available to be and to be accessible. The service call center is still operating. We have redone the wording on that call center message to try to direct people. We were concerned because we got reports, obviously, that people were on there for a long period of time. So we now have given them information about how they can then get to at least the ombudsman's office. We have now are using additional individuals that have been provided by Deloitte to be able to answer ombudsman's calls. We have brought on temporary workers to answer calls in the Ombudsman's office. So right now, what we're trying to do is that we're trying to direct individuals to get to someone that can answer their calls as soon as possible. And we're trying to get those returned within a 24 to 48-hour period. We've been able to be pretty successful in getting those done within 24 hours that somebody reaches back out to them. We certainly still have constituent services, so as these are they're triaged or as they're prioritized, we take these calls off. We try to make sure that we get someone that can call them back immediately if we think that there is, if something needs to be prioritized. We think that someone is, losing benefits or whatever. So there has been an enormous amount of new personnel that have been added to try to add to the call centers, to add to the Ombudsman's office, and we've also increased a lot of by 185, I believe it is, 185 new workers in the field just in the last few weeks. So we think that this will hopefully be able to address some of this sort of overflow that is happening. So is there anything else you might want to add to that? Adrian?
I'll just add one thing, Secretary Glisson. I think it's important to note that we have put a notification up on the Benefind website also that people who come to the website can see. That will help them to understand, whether their benefits will be fine based on a notification that they receive, so may, not require everyone to call in. So that would bring volumes down as well.
And we also added a notice on the Cabinet's website as well, and you can leave an email there. We have folks that are dedicated to returning those emails and responding to those emails as well.
In summation, it's not worked as was anticipated. We held off the implementation of this, and yet even with that delay and the things that have been put in place and the workarounds that have been discussed, there has been noted, still some difficulties in this rolling out. And yet, as you've heard, these have been addressed. We have worked tirelessly. I am so proud of this team, of those in this administration, and of Deloitte's willingness as well to step up and take ownership and to pour into this, and I'm grateful for that. The net result of this will be better. Out of this pain, out of this suffering, out of this difficulty that we are in, we will have a system that is not only as compliant, but it is an example, I believe, ultimately, for how these benefits will be implemented in other states around the country. That is the challenge before us, but that is also the opportunity. And I am confident that in the end, due to the result of a tremendous amount of hard work, and I again want to thank one final time those individuals in our offices who are working their tails off and dealing with a whole lot of less than desirable hours and involvements to make this work for the people of Kentucky. And I'm grateful to them. I thank you for being here in the press. Continue to stay tuned as this develops. And I thank you for your attention to the facts. Thank you. Appreciate it. Thank you all.